So good morning. Today, let's see about the cardiac cycle. And heart sounds. So cardiac cycle, it is under cardiac cycle, we will see about the definition, events in cardiac cycle, and the arterial and ventricular pressure changes during cardiac cycle, and also volume changes during cardiac cycle, jugular venous pressure, and ECG changes, heart sounds, or phonocardiography. So coming to cardiac cycle is the cyclical events or the sequence of events happens in the heart. That is a sequence of electrical and mechanical events that occur when the heart beat is known as cardiac cycle. So there are two phases in the cardiac cycle, that is diastole and systole. Coming to the diastole, that is the process, that is the phase where the myocardium relaxed during the cardiac cycle. And when the myocardium contracts is known as systole. So atrial systole is when atria contract and ventricular systole is when ventricles contract. So this is the process, atrial and ventricular contraction during the cardiac cycle, and this process is known as the cardiac cycle. So we are going to see in detail about the contraction and relaxation and what all the things happens during this contraction and relaxation. So the total duration of cardiac cycle is around 0.8 seconds, that is if the heart beat is 72 and in per minute, that is 0.8 second, and the arterial systole is 0.1 second and ventricular systole is 0.3 second, and ventricular diastole is 0.5 second and atrial diastole is 0.7 seconds. So this is the process of a cardiac cycle in schematic representation. Here the atrial systole first, then coming to the isovolumetric contraction and ventricular systole and ventricular relaxation. So the events are further divided into atrial systole 0.1 second and the ventricular systole, this 0.3 second is further divided into isovolumetric ventricular contraction, that is 0.05 second, and ventricular systole proper, that is 0.25 second, that includes again rapid ejection 0.1 second and slow ejection for 0.15 second. So the ventricular diastole is 0.5 second, that is again divided into protodiastole for 0.04 second, isovolumetric ventricular relaxation for 0.06 second, first rapid filling phase for 0.1 second, diastasis 0.02 second, and these phases are included in the ventricular diastole, and that the last phase is the last rapid filling phase for 0.1 second, and the atrial diastole will happen during this phase, and that is only one phase, that is for 4.7 seconds. So in the cardiac cycle, first there will be the opening of atrioventricular valve, that is the tricuspid and mitral, causing rapid filling. The rapid filling causes decreased ventricular filling or diastasis and atrial contraction. And closing of the next coming to the closing of AV valve, that is isovolumetric ventricular contraction. Then the semilunar valve will open, that is the rapid ventricular ejection and decreased ventricular ejection. And then there is the closure of semilunar valve will happen, that is isovolumetric ventricular relaxation. So first what will happen is from the atrium to the ventricle, the blood is gushed in, that is known as the rapid ventricular filling. And then the blood will slowly enter, that is known as the decreased ventricular filling. After that, atrial contraction will happen. So before atrial contraction itself, because of the opening of valve, the ventricle starts filling up. After once it reaches the field or once it reaches the maximum, the wavy valve will close, and that is known as the isovolumetric ventricular contraction. That is, the volume is same with the same volume of blood inside or the maximum blood inside, the ventricular musculature starts contracting. That is known as the isovolumetric ventricular contraction. Once the pressure is more above, what will happen is there is a sudden opening of the semilunar valve causes rapid ventricular ejection. Means the blood from the ventricle gushed out of the ventricle towards the pulmonary and aortic valve. And after the rapid ejection, then there is, because of the muscle contraction, there is slow or decreased ventricular ejection. Once the blood moves out of the ventricle, the semilunar valve closes, and that is known as isovolumetric ventricular relaxation. That is, the ventricle starts relaxing with all the valves closed. And once again there is a pressure change that causes the opening of AV valve. So from this it is clear that the valves are opening and closing because of the pressure changes happening in the ventricle. So let's see about the atrial systole in detail. So prior to the atrial systole, blood has been flowing passively from the atrium into the ventricle through the opened AV valve. So we have seen that first the AV valve will open because the atria will be full of blood, and once the pressure is more, the AV valve will open. So once here the blood starts flowing from the atria to the ventricle, and once it reaches a maximum blood, that causes the atrial systole, and the atrium contracts and tops off the volume in the ventricle with only 20% of blood. And atrial contraction is complete before the ventricle begins to contract. So last time we have seen that there is an the atrioventricular differentiation is there, there is a fibular ring is there, and that also causes the impulse to transfer very slowly from the atria to the ventricle. So this is the condition where the atria contract faster than ventricle, even though it acts as a syncytium. So here we have written some waves. Here the A wave, this last yellow line is the atrial pressure curve. In here, the A wave, there is a positive A wave is there. That is there because of the atrial contraction. And the red curve is a ventricular pressure, and the white line is the ventricular volume, and this green line is the aortic volume. So see here, only the atrial pressure shows a small difference. Also, the there is a minor change in the ventricular volume, but that is not that much prominent because the ventricles got filled almost before the atrium starts contracting. Only 20% of blood will comes into the ventricle during the atrial contraction period. So next, coming to the isovolumetric contraction, isovolumetric ventricular contraction, that is the beginning of systole. So here, see here, the atrioventricular valve close at the beginning of this phase. The atrioventricular valves are closed, and also these two valves are also closed. That is, the aortic and pulmonary valves are also closed. So the mechanically ventricular systole is defined as the interval between the closing of AV valve and the opening of semilunar valve. So that is this very minor time is there between the opening of semilunar valve and the closure of the atrioventricular valve, and that period, that very short period, is known as the isovolumetric contraction. So this pressure and volume changes. See here, that is a very minute, in a very short time interval. Here, the AV valve closes when the pressure in the ventricle exceeds the pressure in the atria. See here, this red line. The AV valve closes when the pressure in the ventricle, this red line, exceeds the pressure in the atrial. So that is the yellow line. As the ventricle contract isovolumetrically, there is no change in the volume. See here in the white line, there is no change in the volume, but the pressure is sharply shooting up. The pressure sharply moves up and approaches the pressure of the aorta and the pulmonary arteries. That is the green line here. So once the ventricular pressure is moving or going above the atrial and pulmonary arterial pressure, then the pulmonary arteries and the aorta will open. The valves are opening, and that is known as the rapid ejection. The semilunar valve opened at the beginning of this phase. So what will happen is the ventricle continue to contract and the pressure is more than the pressure in the aorta. The pressure is more than the pressure in the aorta. So the volume suddenly decreases. See the white line, the volume suddenly decreases and the right ventricular contraction pushes the tricuspid valve into the atrium. That is another change. Let's see in the diagram. See here, this rapid pull pushes this atrioventricular valve just a little towards the atria. This sudden gush of blood will push this valve to the atria, and that causes a small change or small positive valve wave in the atrial pressure, and that wave is denoted as C. Next one is the reduced ejection, that is the end of systole, and that is the end of this phase. What will happen is the semilunar valve will close, means there is much blood is moved to the aorta and the pulmonary artery. So the pressure inside of these arteries are, these vessels are more, so these valves will close. After the peak in the ventricular and arterial pressures, see here the red and green lines, the blood flow out of the ventricle decreases and ventricular volume decreases very slowly. You can see here the ventricular volume is coming down, very down. There is not much blood is present in the ventricles, and the pressure also falls down during the rapid ejection phase, and it falls below the aortic and pulmonary arterial pressure. The ventricular pressure falls below the atrial and aortic and pulmonary arterial pressure. So when the pressure in the ventricle falls below pressure in the arteries, the blood in the arteries begin to flow back toward the semilunar to the ventricle and causes the semilunar valve to close. So the stroke volume, that is the amount of blood ejected by each ventricle per beat at rest, that is around 70 to 80 ml, and that is the 60% of the end diastolic volume. The end of the diastole, how much blood is present in the ventricle after the end of diastole is known as the end diastolic volume, that is around 120 ml. So the ejection fraction means percentage of end diastolic volume that is ejected with each heartbeat is known as ejection fraction. Next, coming to the isovolumetric relaxation. Here, the first phase is protodiastole for 0.4 seconds. That is, at the end of the systole, ventricular pressure drops more rapidly, but arterial pressure is more sustained due to elastic recoil. So, as a result, the semilunar valve closes sharply, causing the second heart sound. So, the next stage is the isovolumetric relaxation. That is, the AV valves are closed and also the pulmonary and aortic valves also closed. So the ventricles are just like a closed chamber, and that closed chamber starts to relax, and that stage is known as the isovolumetric relaxation. Here, the ventricular pressure moves down sharply, and the atrium in diastole has been filling with blood on top of the closed AV valve. So what is we are not checking the atrial pressure for quite some time. After the C wave happens, then we can observe a sharp increase or a consistent increase in the atrial pressure during these periods. During the rapid ejection and during the slow ejection, also during the isovolumetric relaxation, there is a consistent increase in the pressure in the atrium happens. Because of the venous return, the blood is filling in the atrium during this period. So, what will happen is the pressure in the ventricle starts to drop, but the pressure in the atrium starts to increase. The pressure in the ventricle, see the red line, it starts to decrease, but the pressure in the atrium starts to increase. So once the pressure in the ventricles falls below the pressure in the atrium, then there is the opening of the atrioventricular valve. So, once the AV valve opened, the blood has accumulated in the atria, flows rapidly into the ventricles. causes, there is a increase in the volume. You can see the white line. Immediately there is a sharp increase in the ventricular volume, but there is no change in any pressures. Here we can observe that the atrial pressure decreases. Once the valve open and the blood gush into the ventricle, the pressure starts decreasing and the ventricular volume starts increasing. Next one is the reduced ventricular filling. Due to continuous venous return, filling of the atria and ventricles happens. And the blood slowly went into the ventricles and there is an increase in the ventricular pressure volume again. And there is the atrial pressure slowly maintain the constant decreased level. So this is the intra-atrial pressure during the cardiac cycle, and that is known as the jugular venous pressure. The A is the first positive wave, and that is due to the atrial systole. X is the relaxed wave, which causes due to the relaxation of the atria, and that is due to the AV valve close at the end of this wave. C wave, we have seen that is a positive wave that happens due to the isometric ventricular contraction because of the bulging of AV valve into the atria. X1 is the ventricular ejection, that is a negative wave, and AV ring pulled down during this ejection period. And V is the atrial diastole, that is because of the venous return, there is a gradual filling of atria, and that is a positive wave again. And Y is the negative wave because of the opening of AV valve, blood rushes into the ventricle. So let's see that diagram once again. See here, A is a positive wave, X is a negative wave, C is a positive wave again, and next coming to the slope, and then the V again, slowly it is happening. Next, coming to the intraventricular pressure. The maximum intraventricular pressure is 120 millimeters of mercury, and in the left ventricle, and 25 millimeters of mercury in right ventricle. The minimum pressure in the left ventricle is 0 to 5 millimeters of mercury, and in the right ventricle it is 0 to 3 millimeters of mercury. So this intraventricular pressure, which helps to maintain the blood flow into the systemic and pulmonary circulation. This is the graph which shows all the events which is happening in the cardiac cycle. We can see the opening of AV valve, opening of semilunar valve, then causes the closure of semilunar valve, then starts the opening of the atrioventricular valve. So coming to the intraventricular pressure, the positive wave is due to the atrial systole. There, the pressure rises by 6 to 8 millimeters of mercury. So, end of this causes the closure of AV valve that produces the first heart sound, which indicates the beginning of clinical systole. And isometric contraction shows a sharp rise in intraventricular pressure and denotes the opening of semilunar valve. And Intraventricular pressure rises to a maximum summit during rapid ejection period, following by a fall during slow ejection period. So the end of this denotes the closure of semilunar valve or the second heart sound. And this indicates the end of clinical systole. And intraventricular pressure continues to fall during protodiastole, followed by a sharp fall during isometric relaxation when falls below atrial pressure that causes the opening of the AV valve. So, the intraventricular pressure continues to be low both during rapid and slow filling phase as ventricle continue to relax till the end of ventricular pressure curve. So, these are all the graphical representation again. Let's see the ECG changes during cardiac cycle. The P wave precedes atrial systole due to atrial depolarization. And QRS is the ventricular complex precedes ventricular systole and T due to ventricular repolarization and coincide with the closure of semilunar valve. Here is the diagram which shows the P, QRS and T wave, also the heart sounds and the ventricular pressure. Let's see the heart sounds now. These are all caused by the mechanical events during each cardiac cycle. So it is studied by the phonocardiography or stethoscope, and these sounds are caused by the vibrations due to rapid closure of the valve and the cardiac musculature. It also produced due to the contraction of cardiac muscle and the turbulence caused by the rush of blood from the atria to the ventricles. The heart sounds are used as a diagnostic purpose in the cardiovascular diseases, and the first heart sound is caused by the rapid closure of AV valve during isometric contraction and early part of ejection. So it is a long duration sound with soft and low pitched, and it is loud and it is known as lub. And this is coincide with the peak of R wave of the ECG. So let's see in detail. It is generated by the vibration of blood and the ventricular valve and also by the vibrations of contracting myocardium. It is louder, longer, more resonant than the second heart sound. So it is loud, long and more resonant. This is known as lub. The second heart sound is due to the rapid closure of semilunar valve during the onset of ventricular diastole. It is short, sharp and high pitched, and it is denoted as dub, which is coincide with the T wave of the ECG. So this is the closure of the AV, aortic and pulmonary valve. It is also produced due to the vibration of blood and the aorta. And it closes, the aortic valve closes slightly before the pulmonary valve. And only in disease conditions we can clearly differentiate these changes. Otherwise, we won't recognize the closure of valves separately. The third heart sound is a diastolic sound not heard normally through the stethoscope. It is due to the opening of atrioventricular valve, vibration set up in the ventricular valve due to the rush of blood into ventricle during rapid filling phase. And fourth heart sound due to atrial contraction, which is heard, which can't be heard. It is only been recorded, which is a soft sound of soft duration. And there are 4 auscultatory areas in our body. That is, the main auscultatory areas are aortic, that is in the second right intercostal space close to sternal border. Pulmonary area, that is in the second left intercostal space close to sternal border. Mitral area, that is in the lowermost and outermost point of precordium. And tricuspid, it is in the lower end of sternum. So these are all the auscultatory areas of chest where the vibrations of each valve are heard or felt more prominently. That areas are known as the auscultatory areas. And coming to the cardiac murmur, the abnormal heart sounds are known as the cardiac murmurs. That is due to the blood flow becoming turbulent. It is seen in valvular diseases, septal defects, and defects in the blood vessels. It is the palpable murmurs are known as thrills, which are seen in aortic stenosis. And there are 3 types of murmurs. They are systolic, diastolic, and continuous murmurs. So the systolic murmurs are seen in incompetence of atrioventricular valve, stenosis of semilunar valve, anemia, septal defect, and coarctation of aorta. Diastolic murmurs are seen in stenosis of AV valve and incompetence of semilunar valve. Continuous murmurs are seen in patent ductus arteriosus. So thank you.